approval of the minutes of the October 1st meeting of Board of Health. Do we have a motion to approve?
Motion to approve.
Second, yeah.
Next item on the agenda is a motion to approve the minutes of the November 5th meeting.
Motion?
Second.
Approved. The next item on the agenda is the Development Services Report submitted by Matthew Sheen.
Good evening, ladies. As you can see, for this reporting period, we had 3 new businesses, one of which was the Lowell's Farmers Market, which is located at the Hive on the weekends. And we had 5 failures. Pretty much all of the failures were for expired equipment. We did have one closure, the Outback Steakhouse. They were doing preventative maintenance, and they struck the Ansel system. So that turned into a lot of maintenance, and they, I gave them the option. They closed themselves. They were down for about 24 full hours. They had to get the whole restaurant, the whole kitchen clean, sanitized, get the Ansel system up and running again. So other than that, that's all I have for tonight.
And the tattooing thing is still pending?
Yes, yep. I believe, so after when we last discussed that, I had sent it to, just to have law check it out, because I just want to add it to the back of the permit. No, there's no new fee, but I just want to make sure that I can just literally put that on the back of the permit as an extension to our festival permit. So I'm just waiting to hear back from that, but I'm assuming everything's going to be all right with that.
Okay, so it's important.
Mm-hmm.
Great. Any questions?
All right, thank you very much. Have a good Christmas. Thank you.
Thank you. See you later. The next item on the agenda for review is the Pride Star Trinity report. Good evening.
Good evening, how are you? Before I start, I want to introduce Jacqueline. I'm sure most of you know her.
Good evening. So my name is Jacqueline Allard. I am the Director of Emergency Services for Lowell General, and I also oversee the 911 paramedics at Lowell as well. So thank you for having me.
Yeah. Okay.
Longer than I would have. So the opioid report, kind of we saw a nice return down to the lower numbers for October versus, what we saw in July and August, which is generally the peak in the summer months. Kind of a normal kind of flow of things. We are still looking for funding nationally with the Tufts School of Medicine. We've talked about it a couple times with the APHA and the CDC studies that we had finished up with Tufts and First Watch. We're still looking for funding opportunities that way. We just haven't found any yet, but that continues. We can try to keep leading that way. That's really it on the opioid report, not much. Then the EMS report. So page 4 is another quarter without the need of outside mutual aid. I know we don't talk about it a lot, but again, when you look at the state of EMS in the world, and especially Massachusetts, you have cities that are giving away tens of thousands of trips to needing outside ambulances to come in. I think we're up to 2 years now without having to have Tewksbury Fire or Pelham or something come in to take care of the patient for us. So something we're pretty proud of.
It's significant. That is.
Yes. Our shoot time process is still working pretty well. We had that problem 2 quarters ago where we missed the contractual obligations. Our management team is doing that really well. We send out a report every morning. The supervisors and managers are actively, and the crews are doing a great job responding to it. So that is kind of showed in the numbers. We're at that 91% for the first 4. Again, we continue to work to improve. We always want to do better than we're doing today. And then on page 7, we had the highlighted, the ones in yellows were the ALS patients. Now, the interesting thing, we've talked about it before, is all of those ALS ones that are over 12 would be kind of those high risk. Well, all of them happen to be the instances when we send our paramedic truck. So sometimes, you end up with kind of an accidental ALS patient. There was an OB patient that wouldn't have gone ALS if our paramedic truck wasn't already there. They gave her an IV and they kind of gave her some Zofran, but really nothing critical. But, those are those 12. On page 9, we have the ALS KPI stuff. The Lowell General Paramedics' outstanding job as always. There was a little dip in our intubation first-rate success. We talked about last time we brought on a new company, Patriot Ambulance, and they didn't have the video laryngoscopes, so kind of that dip is because that division didn't have those. We've since bought them. The training is finishing up this week. So again, the intubation rate here was fine, but as a company, we kind of get those new medics that they didn't have the right equipment, so we've kind of brought that on for them. So that should start to go up. Maybe not Q4, but Q1 of '26, it certainly will. And then kind of the last thing on page 14, you can see we only hired one person. That was kind of intentional. We've been, since '21, anybody who's willing to show up, we've been hiring everybody, even if they wanted to work 30 minutes every 4 weeks. But we've gotten to the point internally where we don't need to do that. So we get a lot of applications for brand new EMTs, and a lot of them only want to work 1 or 2 days. So we've kind of paused that to try to, build up the strength and build up the seniority a little bit more. So we do continue to hire full-time new EMTs, or, if a new EMT is willing to work, 2 or 3 shifts a week, that's something we're looking at. Take a breath. Does anybody have any questions?
No. At the risk of being picky, page 8, under the middle column where it has the complaints at dispatch,
Yes.
it says compliant. Right?
Typo.
Thank you. But,
My copy says compliant.
what does that spell? Well, let's at least get the wrong word spelled correctly. That's what I was checking on. Did I at least spell the wrong word?
You spelled
correctly?
compliant correctly.
I do that very well. All right, I'll fix that. Thank you.
It comes from being the sister of an English teacher. Anyways. Thank you very much.
All right.
Thank
Thank
you.
I just
Mary-
wanted to say thank you. Dave Green is here. I just wanted to say thank you to Dave. He, with his partner, ran multiple CPR classes, BLS classes within the city during October and November. And I just wanted to say thank you for getting multiple staff members within the city certified in BLS, CPR, and AED. So I just want to say thank you.
Thank you.
Merry
Thank
Christmas.
you.
Happy New Year. See
Happy
you next
Christmas,
year.
you guys.
Thank you.
Next item on the agenda is the Tobacco Control Monthly Report as sent. Any questions? The permit suspensions were issued and completed.
Why are there no compliance checks this month?
It just happened, so this was short because the report ended up going out like right before, so I think we only had like 2.5 weeks.
Oh,
You'll see
okay.
most of the reports
I
are
see.
kind of short.
Yeah.
Gotcha.
The next item on the agenda is the nomination of
Bye. Happy
Inspector
holidays.
of Animals for Jern Kilsdonk. As a nomination for Inspector of Animals.
Yes, and Carrie tells me all the paperwork is in order, so we do need a motion to accept.
Motion?
And a second?
Second.
And then we do need to vote. Joanne,
Yes.
Kathleen,
Yes.
and Ally.
Yes.
Thank you.
Good evening, Mr. Manager.
Hey.
Yeah, we are.
We are.
Yeah.
Yeah.
6.
6.
You
Yeah,
can.
you can
They'll,
visit.
they'll cut it out. Have a good
Thank
night.
you. The next item on the agenda for discussion is the syringe service program.
So I just added this just so that Madam Chair could catch everybody up on, or I could, on what was going on since the last meeting. Because the last time, we didn't have the maps
Okay.
I know a couple of meetings ago, I did talk about what would happen if they did, the second one, Ally, if we did do 1,000 feet and 1,000 from schools and 1,100 feet from parks. So that would be the second map. So that would basically be most of the city. And then the second is 1,000 feet from the schools. So the one with just the blue is that. So then, last week I wrote a motion response, and Madam Chair can catch you up on the meeting from
Is
last.
this Lower Centerville here?
That would,
Tuckerville, I
Is it
think.
Pawtuckaville?
Mm-hmm.
Okay.
that would be,
I'm trying to
I
orient
didn't
myself
look.
to the map, that's all, you guys. Because the writing is so small. I can't
yeah,
read
so
it.
this is Belvedere. So this
Yeah,
is
so
South
this is
Lowell.
Pawtuckaville.
This is the Highlands.
Highland,
So
Centerville.
this is Pawtuckaville, I believe,
Okay.
yeah. 'Cause this brings us over to,
So if you did 1,000 feet from a school and a park, it would basically eliminate the needle exchange program, except for out here by the forest, the Drake Estate Forest, or one little piece in the corner of Belvedere would be an option. So obviously not an ideal place for needle exchange accessibility.
That's
So,
Lower Belvedere though, right? Like that's down this way towards like, down lower towards
no.
Church Street and all that?
it's hard to see the streets.
I know, that's what I'm saying, I can't really read the streets.
No, this is the Highlands. This is Belvedere over
Oh, this is Belvedere over
here.
here?
Yeah, that's
It is?
the Highlands.
Can you read that, Alice?
yeah,
No.
this is the Highlands here.
No, the Highlands is over here. This is Pawtuckaville, this is the forest right out here.
Yeah, so that's over there.
This is Belvedere.
Okay.
But what part of Belvedere is that? Is that towards Tewksbury line right
Yep,
here?
I
Okay.
think,
Yeah, okay.
right?
Where are you looking?
Yeah.
Yeah, that's towards Tewksbury.
So this is right here, Lower Highlands?
Yes,
So there are some small areas here and over here.
right. But it's gonna push you to residential, basically.
Yeah.
So any of these here
So hard.
is gonna put you to
What's this
residential.
little white spot in the middle? Where's that?
So this basically, I believe, is gonna be like the Lord Overpass.
Yeah.
Oh,
I think is what that
Looks
is.
like a
is the
highway.
Lord Overpass. Possibly.
Anyways, so, last Tuesday, not last night, but last Tuesday, Erin and I went and spoke before the city council and pleaded with them not to eliminate syringe service programs. There was a lot of discussion, and it ended up, the motion was referred to the city council subcommittee on public safety. And the plan was agreed that the folks that spoke at our last meeting from the Department of Public Health and the members of the Board of Health and the city council subcommittee would sit down and talk about it.
okay.
And the city councilors that came to the DPH presentation last month said they found it very helpful, learned a lot, and seemed more receptive to some of the discussion. So Lisa is going to give the manager the DPH contact information, and he will invite, as soon as we can get a subcommittee of the city council, public safety subcommittee, and dates that the DPH can come and we can come, find a date that we can talk about it. So there was a discussion about, the fact that Council Mercy brought up that she thought that people shouldn't be given clean needles unless they brought in 10 dirty needles. And I tried to explain that we're trying to get people to come and get clean needles, and we don't want them to show up with 8 dirty needles and not be able to get clean needles. And they come in packs of 10, and that's how they're distributed. And that we want people to come and get clean needles and use the services. And I explained the data around 3 to 5 times, more likely to get into a drug treatment facility if you use a clean needle, et cetera, the services provided, some of the information we learned at the last meeting. The thing that I don't think is clear to the council is that the syringe service program is picking up hundreds of thousands of syringes. So there's three kiosks that DPH funds. These programs are all funded by the State Health Department. 3 kiosks that picked up 357,000 pounds of syringes last year.
Can I interrupt you on that? So who comes and empties those?
kiosks.
So DPH disposes of them,
They
right?
pay, just like, so
Well, no,
that,
they pay a
so the
service to
health
do that.
department has
Yeah.
one, and I believe I use, BD waste maybe, but there are different, there's a
And they
few,
empty them how often?
there's a few different, people. So either when it's filled or it's on a, like, 6-week cycle, 3-week cycle,
Yeah,
or whatever.
okay.
Or if it's too full, you can actually call.
Mm-hmm.
So Andres manages mine.
Oh, yeah,
So usually they come at the same time, like once a month, and empty all
Yeah,
of
yeah,
them.
yeah, yeah.
And then they also empty Andres's. So it's on a cycle usually that they
okay,
do it.
sorry, I didn't mean to interrupt, I
That's
just wanted to have a clear understanding of the process.
No, it's okay.
So, and also, so, I don't have the numbers with me, but there's, you know, there's somewhat less, there's a little less syringes collected than there are dispensed. But some people don't bring 10 dirty needles. But had a discussion about the point of this clean needles is to prevent the spread of HIV and a host of other things, Hep C and blah, blah, blah. And that we had an outbreak, and that's how syringe service programs came to be. That there was an outbreak in the city, very concerning to CDC. They actually came to the city of Lowell in 2018, along with the state health department, studied where the transmission was occurring, and this is what they asked us to do, have a syringe service program. You know, we talked about having 2 IV drug users, one who uses the program and doesn't get disease or spread it, and brings their dirty needles to a program, and the other one that doesn't use clean needles, that disposes of their syringes. And their concern was syringe disposal, but I brought up the issue of the state health department offering at our last meeting to assist with cleanup, because they have a syringe service program here, and they offered to help with syringe cleanup. So, that was the vote, to send it to the subcommittee, and that's what we're waiting for, is a date on a subcommittee
There
meeting.
was some concern expressed by some of the people here about like behaviors and kids walking to school and getting sort of propositioned, or, you know, there were various comments regarding that. Around these sites, is there any law enforcement people around? Like, are they stationed there? You know, how can we assist to ease
So,
that concern?
I think the plan is to have a buffer zone. We just can't have a buffer zone of 1,000 feet from both a school and a park. So I think when it goes to the subcommittee, we're not opposed, I mean, I'm not opposed, I don't think the board is opposed to having a buffer zone
No.
around schools. It just can't be 1,000 feet from both. And I think that it sounded like what they were saying is that they're interested in 1,000 feet from the schools. It would mean that they would have to have a waiver for the unit on Middlesex Street, right?
Possibly. They did talk a little bit about the brick and mortar, so there'd be a little bit more conversation about the brick and mortar. The other thing is that the way
What
that
do you mean by the brick and mortar? I'm sorry.
there's one that's a brick and mortar versus
Oh,
a.
I
One's
see.
an actual physical site and one's
I
a
see.
mobile van.
Okay,
Right.
I knew there was a mobile van, I didn't
Right,
realize.
and then there was I gave you the sample ordinance, I believe, as
Yeah.
well. But the sample ordinance did talk about the kiosks, and kiosks would be within 1,000 feet of the schools.
I guess I'm just trying to alleviate those concerns.
Right.
And so if we can have an answer or sort of an idea about
But
what
we-
services are available.
But we
for
have,
that.
like, we have people who are, so yes, the syringe service programs wouldn't be within 1,000, like, wouldn't be within 1,000 feet, but the Elliott Church is within 1,000 feet of the school.
Okay,
And homeless people go to the Elliott
Right.
Church. So I don't know how we could say that there's not gonna be homeless people.
yeah,
And
I'm
that's
not
across the
drawing a
street.
conclusion myself, like,
Yeah.
I'm not saying that, I'm just saying this is a verbalized concern.
Correct,
I
but I'm
wanna make-
saying that taking away the syringe service program is not gonna take away.
Yeah, I'm not
the
an advocate
people-
for taking that away in
Right.
any way, shape, or form.
But that's not, but taking this service away is not gonna take away the people
Correct.
who are
It's
coming
not.
up to
I
those
totally
kids.
agree.
Yeah, it's
I
not-
100% agree. I'm just trying to think of what is the city's response to their concerns to having people near schools that are doing those things.
I don't control that.
I know you don't, but I just thought we could have a conversation, we could have that information maybe provided so that
Well, we
those
will be at the
concerns when
public
they.
safety subcommittee,
Yeah.
so we can bring it up.
Yeah, so when
And-
those people
yeah.
bring those concerns up, there's an answer for them. So it doesn't get
Right,
confused and,
Yes.
you know,
Right.
Yeah.
charged. the conversation.
Yeah, and someone, I think it was Counselor Gitche, asked if there was ever a student that was struck by a dirty needle in the park, and we're not aware of any, and I think we would be
Yeah,
made
I
aware
would
of
hope
that.
so,
I think
yeah.
everybody would be aware.
Yes, I would hope so. Yeah, knock on wood, yeah.
The problem is, I think that the city council is trying to put in requirements in the ordinance that DPH doesn't have of the syringe service program that they're funding. So in other words, if they said, DPH isn't gonna say you have to get 10 needles to give out 10. And so I think it would be helpful if we had a copy of the DPH grant to these two sites.
And I don't know if they're the same requirements for each one, so I don't know. So, I mean, I could ask.
Yeah, I wonder if we could see that, so that we would know what standard they're trying to set for the syringe service program.
And the other thing that had been put in the ordinance was that a kiosk couldn't be within 1,000 feet of a school, which that would take away my kiosk at the health department, so that would be a problem.
So
And
as far as
diabetics
the-
drop off their needles,
Yeah,
so.
exactly. So as far as the DPH being willing to help with syringe cleanup, maybe any information we can get on exactly what that would look like might help to alleviate some concerns as well.
So Lisa's gonna speak to them about, well, she's already given them a notice that we'd like them to come to the subcommittee meeting, right?
Yep.
So maybe they could get, firm up on,
Right.
how they might be able to help through the grant.
Right.
And it was their offer, so I'm sure they're working
Yeah.
on something. And they offered, so, yeah.
In the ordinance, it said that the syringe service program should provide the demographic profiles of the participants served.
There
Now,
is no demographic profile for most of these people. So,
I mean,
yeah, I
Deep-
hear ya.
from working at DPH, I know that they would not be looking for that information, nor would they feel it would be appropriate to collect that kind of
Right.
information.
Why would that even be?
Yeah, relevant.
Are they trying to figure out if they're actual Lowell residents or somehow
I don't know.
Probably,
identify
yeah.
people for, you
They
know,
probably want to know if they're non-Lowell residents or
Right.
something. I don't know. And so the ordinance needs some work, and hopefully we can have some input into the ordinance.
The ordinance did not pass. So
Right.
the ordinance, the council did not agree with the ordinance. The ordinance did not pass.
Well, it's obviously non-functional, it's not going to work,
Yeah.
you know what I'm saying? I mean, maybe they can compromise, I don't know if there's a map of what 750 feet above versus 500 versus 1,000, and how much difference that makes, or how maybe that would be something that would help people feel a little bit more confident moving forward. I don't know what that would actually open up, if really anything pragmatically would change with that map, you know?
Well, one is this one is schools, and this one is schools and parks, right?
Right.
Yeah, 1,000 for each, yeah.
Right. So I think they were saying they would prefer it to be 1,000 or 750 from schools. If they,
1,000 schools, yeah.
and then they wouldn't do the park
I
one.
see, so it'd just be either
It
or.
would be just this one.
That does leave more room.
Leaves, but then, like you said, for the brick and mortar one, they'd need a waiver or some type of other.
Arrangement.
So speaking of syringes, well, I guess we'll move on to the departmental divisional reports and updates.
That meeting with them will be in the new year, separate from this monthly meeting, we'll have a meeting. with
Most
them.
likely, yes, yeah.
Yes, it wouldn't be at our meeting, it would be
Right. It will be a city council subcommittee.
subcommittee.
Yeah, I'd like to be there, I'd like to be
Yes.
part of
Yeah.
that, yeah.
And, I don't know what people's schedules are. I mean, we're assuming it probably won't take place until January, do we think?
Yeah,
Unless,
well, I think they have a lot, like, they're doing a subcommittee tonight, so I think they have a lot of their subcommittee meetings already booked, so, yeah. Syringe,
syringe collection activity. So there was a big dip. Is there a reason for that in collection activity? And like you said, it's part of it is that it's only 3 weeks instead of 4 or 5 weeks.
correct.
But it went from 1,000 collected generally every month, 1,300, 1,000, to
Right.
400. And I didn't know if there was a reason for that.
Yeah, so this was only through the
19.
Yeah, only through the
Also, it's
19th
half
of
the
this
month.
month, so, yeah. Right, so,
Okay. It'll be interesting.
So it'll be
to
interesting to see
what
how
the
many more he.
full November
Right,
numbers
for the
are.
full November numbers, correct.
Okay. Any questions on the Substance Abuse and Prevention Division reports? Okay, and then we have the Public Health Nursing.
And she has a short report as well. She had we're having a hard time with the Maven
Maven?
coming through. We're blocked by printing part of it for some reason, so, and Nicole had a hard time getting it to print, so we have a little bit of an abbreviated report.
But
sorry.
even without that, we see that the TB case numbers have almost doubled for the year.
Yes, they've doubled for the year, but we have 13 patients right now, which is a little lower. At one point, we'd had a couple of higher patients, and we do have our new public health nurse on board, so,
Great,
which is good.
thank goodness. And any questions on the school health unit? 19 delinquent students in grades pre-K to 8 with regards to vaccines.
It might just be that they were newcomers, so it might be that they just are new, so. The high school, I was just at a school nurse meeting, and the high school's actually doing very well with theirs, which they don't usually do well, so.
Great.
So they're excluded, it says here, the kids are excluded from school and all of these students.
Yes.
Good.
So Hope, I announced to the school nurses today, Hope is officially taken Beth's position as the school nurse coordinator now, so she's officially, if you're not interim anymore, she's officially in the position. So, we haven't officially have it. So I did not take the position.
Lisa. And who is the new school nurse leader in Hope's position? Has that been,
No, we will not be filling that position.
okay.
So we will only have 2 clinical nurse managers.
Okay. Do you have a new clinical nurse manager?
No, we used to have 3, so we're just gonna try and run with 2 for a little while to see how that goes. Yep.
Oh, I thought that, was there a nurse from the Stocklosa?
Oh, we had pulled someone up at the end of last year, yes. Kirsten came up at the end of last year.
Oh, okay.
So we have Kirsten and Colleen right now, so, yeah. So we have 2.
And I was asked a question about the Rogers, does that have 900 students?
STEM, yeah, the STEM has about 900.
And do they
So this-
just, they just have one nurse, but they have a floater?
They have one, it's supposed to be 1 3/4 is what it is. So it's 1 3/4, and then that nurse is pulled occasionally if need be. But so we're in the process, so right now, as of today, this week, we hired nurse number 4, and there's a 5th nurse starting as of January. So there's multiple people within different hiring. But the new nurses that we've hired, so 2 of them started out, they're rock stars, started out of the gate, like, ready to go within, like, days. So they're fabulous. But they're hired, like, as floats, so they just need a little bit of time with, like, different diabetics and different things. So it's hard to, like, leave them in one school. So the clinical nurse managers are used as floats.
Okay.
So they're used as floats.
So will the Rogers always have just one in a float, or?
Well, it's 1 3/4. So someone takes the position as second nurse at the STEM and a float. So that's what they are. They're second nurse at the STEM with a float. But if that person isn't there because they're covering somewhere else, like a sub will be in that spot. So someone says, like, so if the second nurse is pulled for somewhere else to cover, but a sub says I can work 9 to 2, like as only a part of a day, they'll go to the STEM Academy. Because you can't cover a school like weird hours. So they'll go to that school for just part of the day. It's hard to cover all the schools, so, yeah. But if someone says they can work as a sub for part of the day, then they usually put that person at the STEM unless we're fully covered everywhere.
As the,
I
so
see.
that's the 3/4 person from 9 to 2 or whatever.
No, the 3/4 is the person who has that as an assignment,
Okay,
yeah. So one of the new people took that as their assignment.
so there's one nurse, then a 3/4 nurse, and occasionally there's a float or a sub. that
And
can
then
go.
sometimes there's a sub if that person's pulled somewhere else, yeah.
How did that come to be a 3/4 position?
Because technically, because of the way that the ratio fits, like the high school freshman academy is the same way, it's 900. So
Okay.
the one person's there, and then somebody else has like a float position along with that, like,
Because the standard is one nurse for every 700 students.
correct, but you can't have like, I mean, it's 900, it's a weird number.
Yeah,
So you give like that school with like an alternative school, or that school with like a float, or,
okay.
it's hard to do. We have 29 buildings
Yeah,
with 32 school nurses, like,
yeah, yeah.
Just patchworking.
it's
Yeah,
a,
you
it's a, yeah, it's a puzzle. Every day's a puzzle.
Thank you. Motion to adjourn? Oh, I'm sorry, wait. Did Madam
I have nothing else.
HHS Director have anything else?
Nope, I'm good, thank you.
Okay. Motion to adjourn? Seconded? So moved?
Only second, thank you.